We've reported on several international medical visits from a host of practitioners. A group of doctors and nurses would normally come for a couple days or sometimes a week and see a few patients. Then they head back home. Medical mission over. Well, the medical director and his team at the Belize Cancer Center in Dangriga aren't settling for a one-time visit. They have partnered with one of the most prestigious medical centers in the world, UCLA, to launch a program where in any given month there will be 3 medical professionals from UCLA stationed at the Cancer Center in Dangriga. It is a major collaborative breakthrough, and after about a year of planning, it's finally official. Today, Courtney Weatherburn traveled to Dangriga to find out how this new partnership will work and what it means for Southerners and the wider population.
This might look like just another regular clinic with its comfy treatment area, its storage supply space, and its medicine refrigerator. But the Belize Cancer Center is so much more for Dangriga residents. For 60-year-old cancer survivor Marjorie Garvin, the center gave her another chance at life.
Then they for me, because if then away they, I don't know what God even take, because right here you could come and get your treatment. If you not got no money, well, that's it. And they help you with everything while you take. Then send me to Honduras for get my next treatment. And
paid for you to go to Honduras to get treatment?
Yes, then pay for me for go to Honduras. I take my treatment there 2 months, 2 weeks, and all under for them expenses. So tanto then are still alive.
And it's not only cancer patients who benefit from the center. The doctors also test and provide treatment for sickle cell anemia. Punta Gorda resident Raquel Romero has been bringing her 8-year-old son Orlando for treatment for 3 years. He was diagnosed with sickle cell anemia at 6 months, and finding out about the center has given her more ease and hope during this challenging journey.
It gives me a little a better idea and less traveling to travel all the way to Belize City and closer to home. With the treatment helped. It has helped him a lot.
According to the center's medical director, Dr. Ellsworth Grant, all their healthcare services will be enhanced, and others included, through a new partnership with one of the leading hospitals in the world, the UCLA Medical Center.
For us, that's an amazing accomplishment to have somebody who will be here in the future, and for the patients to have access to a physician all the time from a continuity of care. I think it will allow us to provide better continuity of care than we're able to now. For the broader community, I think bringing in internal medicine specialists, as well as the capacity in the future to access additional specialists, rheumatologists, endocrinologists, will just fill a gap that we don't have and people would never have had access to. So I think we will make a great big difference in the community with a program such as this one.
The goal of this unique collaboration is to provide higher quality health care for those suffering from chronic diseases.
So based on the assessment that I have done, whether it's at the regional hospital or talking to the physicians in the area and the nurses, like I said, the major need is managing chronic diseases. So that's the one area we're going to focus to do that, to do the diagnosis early and to treat that early to prevent complications, right? Somebody who has diabetes, if we treat that early on here, that person is not going to have kidney failures or lose the eyes or lose the feet, right? So it's a lot of that management of chronic diseases is going to be one of our main focus here. But in addition to that, one of the other need is a lack of subspecialties here. So what we were hoping to do also is to bring groups of subspecialists where the focus would be depending on the month, right? 1 month would be cardiology here. So we were hoping to see everyone with heart disease, or a group of pulmonologists will be here, and then the focus would be on lung disease or rheumatologists. So it goes on.
The plan is to bring 3 different medical professionals from UCLA every month for 9 out of 12 months 2 trainees and 1 specialist. Now, this program is still in its initial stages, but it is a great boost for healthcare in the South, and it can be so for the rest of the country.
I think it's the start here in Dangriga really is the testing grounds for it all, and success here will definitely lead to expansion, and it will make it easier, if not UCLA, for another university to come in and to replicate the mission. But I see it more, in order to do anything to expand, you need to start first.
Reporting for 7 News, I'm Courtney Weatherburn.
The Belize Cancer Center in Dangriga was opened in 2008, and since then the staff has treated about 1,000 patients, and of course that number continues to grow. The doctors from the UCLA Medical Center are expected to arrive in Belize a couple months. Another component of this collaboration is ongoing training and education. The center staff will also benefit from a number of workshops and seminars organized by the UCLA medical professionals. We have more details about that educational program, and we also spoke to a sickle cell anemia patient about how this new initiative will help him and others like him.
As we all recognize in the medical community, it's really important to have ongoing medical education for both the providers but also for our patients. So I help run the residency program, which is a training program for 75 physicians. And as part of that education, we also teach them how to be teachers. And the idea will be to have a sharing of ideas between the physicians here as well as the physicians that will be visiting from all of you in UCLA. We would like to be able to do seminars and have teaching sessions where nurses, physicians, medical students can get updates on disease illnesses that may be affecting the population here, chronic disease management, things like how do you manage diabetes or hypertension in the most cost-conscious way by providing the highest quality care possible.
It's something good for the community, it's something good for the country in a whole. You know, that's why I said we as sickle cell patients, we should not be hiding, the parents should not be hiding us anywhere. You should bring us out. Let them know that you are a patient too, so that you could get the treatment. That's the only way you could survive or live longer.
In terms of the future of the partnership, there are plans to build another clinic to care for more patients, and of course, more planning will be needed to expand this initiative to other parts of the country.